Welcome back to another episode with ByrdAdatto. As things keep changing, we still want to make sure that we continue to have content out there for you guys. And today, this one's really concentrating on our healthcare clients and making sure that we have certain things for you to consider.
Yeah, and so really thinking at it from a big picture again, as it relates to patient care and first and foremost keeping them safe, but secondly, really managing the risk of your practice. You want to first stay in touch with the information available on the Center for Disease Control website, the World Health Organization website, and our sister organization, AMSPA, has a resource center. Highly encourage you to go visit that because there is up-to-date information on things that are developing specifically in healthcare, and if you're a med spa, super specifically as it relates to medical spas, though most of the stuff deals across the board with any medical practice.
Yeah, including they have a webinar and podcast that is open to the public on these particular topics.
Yeah, and like we mentioned in our first one, these videos we normally send to our Access Plus members behind in our Access Plus portal, and because of the COVID-19 crisis, we're bringing them out to the public because hopefully we can provide some guidance and help for businesses and for today's video for healthcare businesses on how to navigate all of this. The first thing that we have about 5 areas as it relates to patients that we want to touch on. The first is telemedicine, and obviously with the circumstances, this is going to be a big increase as an issue of something that may be used by your business and something strategically to think about. For elective medicine, a lot of times the initial exam of a new patient can be handled via telemedicine. So if you're in a circumstance where you may be closed or very limited on patients coming in, you might consider doing some consults by telemedicine to make use of the downtime. And of course, just know that each state regulates telemedicine, and so it's important to stay compliant as you are considering using that as a process. But it can be a really effective tool right now.
Right, and so then once you do figure out that you can still treat patients, is obviously you probably want to go back and re-examine your second area, which is the patient intake. How are you intaking those patients? What kind of questions are you asking before they even walk in through your door? Because obviously you're trying to limit the exposure of the patient to other patients and patients to your staff. So there's obviously a list of 3 to 4 different questions that you want to start considering as to making sure they're still a good candidate to come into your office. And in the event they do come to your office and they had to answer those questions correctly and that you feel like it's safe for them to be there, how are you going to interact with that particular patient? Do you limit the number of people inside of your particular waiting room? Do you make sure that you move people more quickly, spacing out their appointments? These are all the other aspects of it. That this the third area, which is when you are interacting, what are the things you put in place? And it's not just how you're moving them; it's what are you doing with your employees?
Yeah, I mean that gets down to the details. Are they in masks, gowns, gloves? You want to make sure that your kind of protocols on how you're going to have your staff engage with the patients is appropriate for the circumstances, and of course use the resources we referenced to help kind of figure out what's right for you for where you are.
And then finally, last is once that patient does leave, what process have you put in place to make sure you're cleaning that room correctly? Obviously consistent with standard of care, but what other additional things have you decided to start adding into on clearing your room and making sure it's clean in additional ways? Again, consistent with what is expected, generally speaking, and then what additional add-ons are you doing with this outbreak and trying to keep minimizing exposure to your patients and to your staff. I think that's it for right now for these 5 areas. Again, for our Access Plus members, there will be policies that will be dropping that will follow what we just described. For those of you who aren't Access Plus members, remember, these are things you should be considering no matter what to help reduce this crisis. Thank you so much.
Thank you.